CardioWise is a cardiac imaging and software analysis company that simplifies the diagnosis of cardiovascular disease and sets new standards of cardiac care that will reduce the cost of healthcare. Our first product, CardioWise Cardiac MRI Analysis, is available to caregivers and patients so that they can participate in decisions about their care. CardioWise analysis starts with image sequences from one of 25,000 standard MRI systems installed worldwide. Image sequences employ a standard technique known as radiofrequency tagging, shown in the diagram as green and black intersecting planes. The short axis imaging plane is shown perpendicular to them. Let's look at a sequence of short axis images showing the tagging planes. Notice how the intersecting points can be tracked as they deform with the movement of the heart wall muscle. Since the other tagged planes are parallel to the image plane, the long axis images show only a single set of tagged planes. The short and long axis images are compiled into a four-dimensional deformation field that tracks the tagged planes in 3 dimensions through a complete heart cycle. The strain algorithm measures and calculates how far and in what direction points on and within the heart muscle move through a complete heart cycle. This image is hard to interpret, however. The genius of the patent-pending software that CardioWise has licensed from Washington University in St. Louis is that it incorporates a normal hearts database that was developed by scanning a large number of volunteers with normal hearts and combining their 3D strain values at a large number of points to form the normal heart model, shown rotating here in space. At each of the 15,300 points in the normal hearts model, there are 3 components of strain calculated. Then the patient data are compared to the normal strain values at each of those same points. The result is rendered as a 3D color normalized strain map, where blue is normal, representing 1 standard deviation from normal. Yellow shows some dysfunction and 1 to 2 standard deviations from normal, and red is not normal, that is greater than 2 standard deviations from normal. CardioWise analysis is a comprehensive test that evaluates all 3 areas of concern: the left ventricle, coronary arteries, and valves. The next image shows CardioWise analysis combined with images of the coronary arteries. It is easy to determine which coronary artery is the cause of the red dysfunctional area. In a similar way, we can evaluate the heart valves. A normal aortic valve is shown in this movie. All 3 leaves of the valve are easily seen and closure is complete, indicating normal function. CardioWise analysis has 3 general types of clinical applications. We can assess a patient to evaluate the microregional contractile function. In this patient, we can see an extensive region of poorly functioning myocardium, or heart muscle, in the posterior area of the left ventricle, where there are 2 areas of red demonstrating greater than 2 standard deviations from normal through the cardiac cycle. This quantitative assessment of microregional cardiac function indicates viable and non-viable myocardium to guide surgeons to more timely intervention, a key to survival for the patient. CardioWise analysis can quantitatively evaluate the results of any intervention, whether it's a drug, a device such as a stent, or surgery such as a bypass operation, shown in this example. The left image clearly shows a large dysfunctional red area in the atrial septal area. The post-bypass image on the right indicates the quantitative improvements as a result of the revascularization and recovery of the hibernating heart muscle. The final example of clinical applications of CardioWise analysis is in the screening of high-risk patients. The results of the latest research at Washington University in St. Louis are shown in this example. Other imaging methods, such as ultrasound, measure global contractile function, and in early stages of disease, global function would appear normal. CardioWise analysis would be able not only to detect and define these early damaged regions, but also monitor them closely for early onset of irreversible contractile injury. Surveillance of these microregions could potentially indicate the threshold after which permanent injury will be sustained and allow timelier surgical referral of patients. No currently available diagnostic test can do this. We would like to thank you for your interest in CardioWise. For more information, please go to www.cardiowiseinc.com.